Hello, my name is Logan Bruffett, and I did my presentation over eating disorders. To begin, let's talk about what are eating disorders. Eating disorders are a serious but treatable mental illness where an individual is obsessed with their eating habits and their body weight or shape. This is life-threatening, and it is classified by restrictive or abnormal eating behaviors. This typically stems from a dissatisfaction with their current body weight or shape and or the fear of gaining weight. Let's talk about some facts and figures. Anorexia has the highest mortality rate among psychiatric illnesses, 5 to 10%. About 2% of women suffer from bulimia during their lifetime, and bulimia is twice as common as anorexia. And later on, we will speak about the differences between those two. Up to 95% of people with anorexia or bulimia are women, though recent studies suggest that the gender gap is less skewed than originally thought. Most people tend to believe that only women have eating disorders, but this is a common misconception, as men have eating disorders as well. And we will talk about a few famous men who have them in the next slide or have suffered from them. Two of the men are Dennis Quaid and Zayn Malik. Unfortunately, I could not find any good comparison pictures, but they have spoke up about suffering from an eating disorder, as well as Lindsay Lohan and Demi Lovato. And in both of their before pictures, you can see how they're just very, very thin arms. They have sunken faces and protruding cheekbones or protruding hips. These are all common signs to look for. There are two main types of eating disorders. These are anorexia nervosa and bulimia nervosa. Both of these stem from, as well as most eating disorders, stem from a dissatisfaction with the current body weight or shape, and or just a fear of gaining weight or looking fat, or just not looking the ideal way the person wants to look. Anorexia nervosa, a person with this would use dramatic restriction of food intake relative to their body weight. This means that they would just cut their calories down. They may have just a cracker or two a day and try and just live off of coffee. Bulimia nervosa is classified by recurrent episodes of eating large amounts of food in one setting and then compensating for the behavior by purging or forcing themselves to throw up. And usually people will describe these episodes of binging or eating a lot as out of control. One lady said that she couldn't even really remember doing it. You're just out of control and you're just eating anything that you can find, even things that you may not like. And then after they've kind of become uncomfortably full, they will compensate for the behavior because they feel guilty by purging and forcing themselves to throw up. Some of the targets are, well, it is important to remember that eating disorders affect all people, no matter their age, sex, race, or ethnicity. However, it does tend to arise more frequently in ages 13 to 20 and in women more so than men. Some people believe that it arises more so in women because of the kind of unrealistic expectations that society puts on how women should look. And women feel that pressure to meet those expectations. Another group of people is that this may target more so is athletes and celebrities because of the unique pressures of their environments. For example, athletes, they may feel pressure from their coaches to lose or gain weight. They may just feel pressure because of just constantly having to weigh in and see that number. Other athletes or teammates may be thinner or look differently. They may feel a pressure to have this ideal athletic body type, and that can make them use eating disorder behaviors. Celebrities is another one. I spoke about a few earlier, and they're typically kind of under a microscope, their lives, and people are very critical of the way they look. So a lot of people will resort to eating disorders. Moving on, some of the signs to look for if you think somebody may have an eating disorder would be drastic weight changes, cold hands or feet, blue lips. If they're antisocial and they don't want to go out, they don't seem like their normal selves, and they don't want to go to meals. They may be tired more so than normal. They could have rotting teeth because of the lack of nutrition, or a rapid heartbeat, or be out of breath after a little activity. Also, a big part is denying that they look thin or malnourished, or that they have an eating disorder. They don't see themselves as that way. They think they look fine. And we'll see a picture in the next slide that kind of describes that. You can see on the right image, Lindsay Lohan, she has rotting teeth because of the eating disorder. And then in the top left corner, you can see a conversation that somebody with an eating disorder might have with themselves, trying to convince themselves, you're not hungry, you're strong, you're just thirsty. You don't need to have more than 500 calories, or you don't need to eat carbs after 4 p.m. They may set these ridiculous expectations in their head of how and what they should eat. And then the middle image shows how a person with an eating disorder would see themselves. No matter how thin they are, they will still see themselves as fat or overweight, or just not the ideal way they would want to look, and they'll criticize and try and just perfect every little part of their body to this ideal image they have in their head. These are just a few before and after pictures of some patients who have suffered from eating disorders. You can see just how thin and how drastic the weight change is. Here's another one. You can see just in her face, she's kind of got sunken eyes and hollow, protruding cheekbones. These are all just some signs to look for. Some behaviors that people with eating disorders will use is excessive, uncontrollable eating. As I mentioned earlier, they feel out of control and they may not even remember doing it. And then followed by episodes of purging because of just the guilt or shame felt from the episode of binging. They may misuse laxatives, diuretics, or diet pills, or restrict their food intake by simply not eating at all. They may work out too much and not put enough nutrients in their body in order to kind of give themselves more energy after working out. They will constantly compare their bodies to others, or weigh themselves, or skip meals. Many people will not fit into a clean cookie cutter diagnosis of an eating disorder. They may use a number of behaviors, but it still should be taken very seriously. The treatment. Early identification of an eating disorder is key. If you're suffering from an eating disorder, please speak up. And if you think you may know someone that is, please try and get them help. Speak out. The first step is a consultation with an eating disorder therapist to identify the type of eating disorder There are no FDA-approved medications because the disorder is behavioral and it's mental. So is the treatment. Depending on the severity of the eating disorder, there are different types of treatment. So outpatient treatment is when they will visit a therapist maybe once a week and talk about how they feel, and just how, their progress. And then an intensive outpatient treatment just means a little bit more frequent, maybe a few times a week, and they will see not only a therapist but a doctor and a dietitian. And then a partial hospitalization treatment would be that they would come in to the hospital daily and kind of meet with their specialist, doctor, clinician, dietitian, therapist. Just kind of grows the more severe. And then some of the higher care treatments are residential treatment, where they will have a clinician or a nurse live with them and monitor their meals, specifically in the time after meals, to make sure they are not purging. And then finally, the most serious is hospital treatment, where the patient will be hospitalized and monitored 24/7 to ensure they are making adequate progress and getting the nutrients they need. It is really important for all of the patient's professionals to be in efficient communication with each other. And when I say that, I mean that the dietitian, the nutritionist, the doctor, nurse, clinician, therapist, all of them need to be constantly updating each other on the patient's progress. It is really important to be sensitive to the situation that this person is in and to speak up if you're going through this. And here are my references. Thank you.